Good morning and welcome to this very important conversation about the impact of COVID 19 on student learning. And we are going to listen to Warren Township school officials discuss what they are doing to help students in this pretty much unprecedented times, as we've been saying over and over again. Uh, my name is Oshia Boyd, and I'm the proud editor of the Indianapolis Recorder newspaper. As you may or may not know, this year we are celebrating our 125th anniversary. So we are really proud to continue the legacy of the recorder and all that we do to serve our community, particularly African Americans in Indianapolis. If you have not seen a recorder lately, you can pick one up, you can subscribe, or you can visit us online at www.indianapolisrecorder.com. Now, I want to take the time to introduce my co host, Emil Ikior, founder and CEO of InnoPower. Welcome, Emil.
Thank you, sir. Welcome. Thank you so much, Osia. Good morning. Might I say you look wonderful this morning?
Thank you.
You're very
And you as
welcome.
well, and you as well.
Thank you. Thank you. It is 9 o'clock on a Friday, right? Well, Osia, this is an important conversation. And, for decades, American schools have been trying to identify culturally responsive services to combat emotional and social isolation affecting our youth today. The need has severely been increased with COVID-19, as you mentioned, unprecedented times. We're seeing more and more depression, more and more anxiety, and many other mental health conditions have increased or worsened um, due to quarantining and social distancing measures. But we're seeing more and more of this with Black and Latino students. Um, so the COVID-19 global pandemic has exposed so much that we knew existed, but even more today, in what we perceive as the cure and prevention for COVID, has created even more issues with our young people.
Yes. And if you are the parents of teens or have ever been a parent of teens, you know how much they need to actually socialize with their peers. Um, I have a teenager, and I tell you, back in probably April, things got really difficult for her. And she's a social butterfly. So there were times when she's like, I can't take this anymore. I'm tired of just seeing you, mom. And I understood she needed to go be with her peers. So we were really happy when she could finally be able to actually socialize a little bit more besides FaceTime and and the internet. So COVID-19 has put a halt to the developmental milestone for teens, and the impact of disparities in social justice, incarceration, and healthcare are also at the forefront of the increased need for mental health services for youth.
Hmm. And at a time like this, the term innovation is so key. Is how do we solve this problem? How do we come up with new ideas and new ways to solve problems like this? And historically, we haven't always done a good job of coming up with innovative ideas to do this. Well, the Warren Community Resource Center is an innovative idea to provide resources for those within the Warren community to help remedy the issues presented by COVID-19.
Mhm.
So the innovation for the Resource Center and what they have created in Warren Township is something that we want to learn about today, and what brought about that innovation, and
Mhm.
how is this going to work for our community. And our role in all of this is to inform our community, educate our community, and come along the Warren Township community as well to support this innovation and make sure it is maximized.
Yes, my three E's at the recorder: educate, engage, empower. So this definitely fits into the three E's that I came into the recorder with. And I think we've always had those three E's, but of course I want to say it's my creation. But I know we've always done it throughout our history since 1895. So I want to take the time to introduce our distinguished panel. And we have some really heavy hitters here. I feel like my little title of editor is just pales in comparison. So we have Dr. Timothy Henson, who was the superintendent of Warren Township Schools, James Taylor, Warren Township Director of Student and Social Services, Moorhead Community Resource Center, District McKinney Vento Coordinator, Tyrone Humphrey Jr., Community Manager of Indy Heartbeat Eskenazi Health, Peggy Serby, Regional 10 Manager, Indiana Department of Child Services. Denise Center, Director of Mental Health and Clinical Services, Reach for Youth, Inc. Dr. Virginia Kane, Director of Marion County Public Health Department. And Carolyn Gentle Kennedy, who among her many titles, she is a professor of social work at IU. So welcome everyone. I'm so glad that you could join us this morning. I know for you school people, like this is late. Because I know you're up and out the house probably like 6, 7 o'clock in the morning. But for like Emil and I, this is early. So welcome.
Well, thank you, Osea. Good morning, Dr. Hanson.
Good morning. Good morning, everyone.
I can only imagine how your life has been in the last 8 months. I mean, a superintendent of a large school district, so many staff, so many students. Can you please share with us how COVID-19 has affected your students, your staff, your community, both emotionally and mentally?
Yes, I have a great team. So as the work's never been harder, but our team has rallied around the work that needs to be done, and we like to use a phrase: it's hard work and it's heart work.
Mm.
I think we finished our strategic plan last school year, right before COVID hit. And as we were working on that strategic plan, we already identified some of the challenges that our community, our students and our families were facing. And really, I feel like we were a step ahead of that, and then COVID came. What I've seen since COVID has happened, I framed it in two buckets. One, it has magnified and multiplied the stress, the challenges, and the weight of life on our students and our families and our staff. Life was already hard before COVID. You mentioned, I use the phrase, it kind of pulled the curtain back on a lot of injustices that were taking place, a lot of inequities that were taking place that for us in the school system, we knew existed because we were trying to support our students and families and staff with those challenges already. And at the same time, it magnified all of that. It's reduced or removed the supports that were needed to address that. The access that our students and our families had to us or to other supports in the community, including healthcare, which is why COVID has had a significant impact on our community and other Black and Brown communities in the area. Access to healthcare was already an issue, right? And this just magnified it and multiplied it. It has reduced and removed the predictability of life. Wow. We are routine people. We want things to be predictable. And when you don't know what's going to happen the next day, that adds stress to your life and to our kids' lives. And when they're already carrying a lot of weight anyway, and don't have that support around them, we mentioned the social piece. That's a social outlet. The social outlet for our students is probably at the top of that needs chart. The interesting thing too, and I'll mention this on the staff, our staff need our kids just as much as our kids need our staff. I had a teacher tell me last week that her bucket was empty because the kids aren't coming to school with the same energy that they once did. The masks are muting our students literally and figuratively. They're not coming in with the same energy. They don't feel confident. Wow. That predictability of what's going to happen, the COVID health impact of our community in terms of hospitalization and deaths, it's taking a big toll on them. So it's impacting us, unfortunately, in a major and negative way. As you'll hear this morning, the Moorhead Community Resource Center is our way to kind of help respond to that and be proactive. Hopefully COVID will go away, but there will still be needs and challenges after that.
Thank you, Dr. Hanson. Thank you so much.
Thank you, Dr. Hanson. You mentioned things that I think we don't often think about. I didn't think about the energy level of the students coming into school. I didn't think about how much this impacts teachers, how much teachers feed off students, how much they need that energy from students, and how this impacts their mental health. I think there's just so many aspects to this that we just continue to learn about daily. And it's just so very interesting to me about how much we don't know still. And we know so much, so we think. And I want to go back and introduce someone I neglected to introduce, Megan Flynn. She is representing community hospitals, behavioral health, that will conduct a therapy on site and virtually in Warren Township. So I want to pivot to you, Dr. Kane, and ask you a question about mental health. Can you share some of your findings that for the Black and Brown communities, mental health disparities that you have found in since COVID has begun? Dr. Kane? Well, we'll come back to you, Dr. Kane.
Let me see.
Okay, there she is.
Can you see me now? Can you hear me?
I can hear you.
Okay, sorry.
Okay, now I see you.
So one of the things that we've seen as a result of this, that for a lot of people of color, a number of them are in the they make the majority of the lowest paying jobs. So as a result of this epidemic, we saw a number of families unfortunately go homeless. Some of them lost having food on the table on a regular basis and trying to figure out how I could find a food pantry, what day is it open, how do I keep my electricity bill from turning off. So the tremendous stress and anxiety related to that was very difficult. And then when we see our violence that has been taking place lately, our people of color have about a greater than 20% chance of developing what we call post-traumatic stress disorder related to our youth. And what's so difficult about this is that a lot of our young people, generations, as well as our older individuals, they don't understand the definition of mental health. They translate this as something that represents a personal weakness. If I've got a mental health disorder, and not realizing that it's a physiological issue. So as such, it is very difficult for them to, many don't have primary care providers, it is difficult for them to get access to this mental health. But sometimes because of shame, they may not get access to the care, but sometimes because of poverty, they feel they don't have the resources to get the care. So it's been a huge burden on them. And my additional point is, when we saw George Floyd and what happened to them, as anyone, you can see that, wow, someone can actually murder a person in front of a lot of people and nothing happened related to that. When we look at Breonna Taylor and what happened with her, it's like, wow, that was my mother or my sister, in that room, and that could happen to them. So it just gives them that really increased anxiety and depression. And my last point, because I don't want to steal the story, is, but when this pandemic happens, a lot of people are hungry. So especially for the Black male, but it happens to everyone. If you go into a store, retail or whatever, sometimes you feel that eyes are following you, or people in the store may be watching you way more closely with the expectation you're going to steal something. And that's a sense that you will get sometime in your lifetime experience that, wow, they're concerned that I might steal something. So I may see an employee come around a corner looking like, trying to keep their eyes on us. So that's a sensation that a lot of white students do not feel compared to our people of color. A tremendous burden.
Thank you, Dr. Kane. You brought up some really important issues I want to make sure we kind of touch on a little bit, go a little bit more in depth. Because as adults, many of us are just now being cognizant of mental health and taking care of our mental health. We still are not really thinking about it for teens, for children. because this should be your happy time. What do you have to worry about? You're not paying bills. We think like this as adults, like this is your carefree time. But as we are learning, especially now, mental health is important for everyone. So I like to ask you, Dr. Center, what should we as parents and guardians, what are some things we should pay attention to, be looking out for when we're talking, or when we see our children, especially in this time?
Yes, thank you. And I so appreciate what Dr. Kane and Dr. Henson has expressed, because what they're describing is really what happens when we lose sight of the core developmental needs that all people have, particularly young people, and what the core pieces are, that emotional social piece before the cognitive and intellectual piece. When our developmental needs are not taken sufficiently into account, then we lose the capacity to learn, we lose the capacity to do the things that we previously did, because the more primary aspects of ourselves are being diminished or isolated or slowed down. And so when Dr. Kane was speaking to what happens because of the physical deficits that happens with not having food sufficiency, when our physical safety is threatened, then we suffer emotionally and socially, as well as cognitively. The way our brains are organized is that's the physical first, then the emotional social regions, and then the cognitive. And why all of those work together is the physical, the emotional, social that are most primary. And when those are sufficiently engaged, and all the supports that's needed to fulfill those needs, then everything can work really well with learning and engaging with school and with teachers and with parents. But when those are not sufficiently met, then we see some deficits. I think in the mental health realm, it's not mental health in terms of not having good mental health. All of us need positive mental health. Positive mental health is based on quality of relationships. It's based on having those safety nets. It's having a sense of security. It's having a sense of belonging. It's having a sense of knowing that people care about you. It's having a sense of knowing that you have something that you can contribute to the lives of other people. And I think what has happened with COVID, it has disrupted all of those essential needs that everyone has had, parents, as well as teens, as well as young children. And so we see a lot of young people regressing and engaging in behaviors that they did when they were 7, 8, 6, and 5 years old. And why is that? It's because those principal physical and emotional security needs have been eroded. And so we kind of regress and go back. So I think everything that we're hearing and I'm going to be talking about today, we have to keep in mind the importance of what Warren Township is doing with Dr. Henson and James Taylor, because they are reconnecting families with community, and all of these community partners that you see here on the screen. Their primary focus is dealing with the human being first and reconnecting them with these important emotional social structures that build up and are necessary for people to function, whether they're children, teens, or parents.
Thank you so much for that. This question is going to be for Tyrone Humphrey, Megan Flynn, and Dr. Janetti. Why did we anticipate the impact COVID was going to have on our young people as we shut down schools and as we send kids home? That's one part of the question. The other part of the question is, as a parent myself, a Black male, I think Dr. Kane mentioned that even I'm guilty of not looking at mental health as something. I just wasn't raised that way, right? As most of us in the Black community were not. How do you identify things in your child or your young person to see what signs do you see to be able to say, okay, I need to take him to the resource center, or I need to call James Taylor because I noticed X, Y, and Z in my son or my daughter. Um, Things that we just haven't been trained to pinpoint and notice. So if you're speaking to Black and brown parents, Latino parents, Black parents, what do we do now? How do we notice, or what do we notice, or what do we look for, or how do we work with the resource center to make sure that our kids are being we're maximizing this resource in Warren Township? Dr. Janetti?
Wonderful question, loaded, but wonderful. And I think it speaks to what all of us are feeling, right? So everything's coming to us at once. But I want to step back and make sure that we're clear with the statement itself. It's not that we did not anticipate. We have anticipated mental health and social well-being for a long time. This is why programs like what happens at Warren, and school programs and school counselors and stopover and all these other programs that we have out there, we know that we need them. I think what happened is that we failed to plan for the severity and the long-term impact of what's going on. We sort of went through, okay, this is a pandemic, and we went into that fight or flight mode, quickly saying, how do I protect myself? How do I protect my children? How do I protect my house? How do I protect my job? And when we do that, we don't have the bandwidth to quickly think about others and go, okay, there are 30 kids in my class, or there's so many in my school, to sort of make that transition. So I think that's one of the key concerns. And when we do that, the typical process of put the mask on yourself before you help your other kids or other people on the plane is key to this point. And we also thought that it was a quick entry and a quick exit. When we deal with death and dying in schools rally around the child, they provide resources to them, there's counseling that's provided. But this one was not like that. It's not a quick entry, it's not a quick exit. We're all hoping it will stop at some point and we could go back to the norm. But really, it's about the severity and the magnitude when it comes to anticipation. And I want to make sure I share the space. And just before I do that, I want to acknowledge what has been said before, that the socio-political stressors also came at the same time the pandemic hit. So in terms of stressors and magnifying that, it went beyond any one of our own capacities to deal with it. And as a result of that, our view of mental health was very different. That mental health structure moved to who I am as a person, which is very different than we've looked at it in the past. And I'm happy to answer more. I have a lot of other thoughts, but I want to share the space.
Megan, could you talk to the parents and talk to us parents as far as what do we look for? How do we know that our child needs to come to the resource center and speak to someone there? Like, how do we start noticing those things and looking for those signs as parents? I think Megan is muted.
Sorry, my security on my computer locked me as soon as you were asking for my name, and I couldn't unmute myself.
That's okay.
No, I think during this time, when we're looking at kids, I think traditionally in academia, we've separated the mind and the body, and we've said, shut your body down so you can learn. And we're seeing through this, the body, especially I work with mostly adolescents, the body's in charge of the show, right? So if the body's not able to, feel safe, feel cared about, then the learning's not going to happen. So I think with parents, as you're home with your kids, and in Warren, we're doing this hybrid model of half virtual, half in person. We're seeing an increase in irritability. I think sometimes we forget that irritability can actually be anxiety. It's not always defiance. It's not always lack of wanting to comply. It's I don't feel safe. I don't feel comfortable. My routine is different. And things are so unsure right now. We're hearing stories like someone mentioned, Breonna Taylor was our mother, our sister. We look like her. So I've seen Warren do an excellent job of remembering, care about the body of these students first, make sure they feel safe, make sure they feel cared about, and more conversations with mothers, with parents, with families about what this looks like. So I think, I think for a lot of my parents that we interact with, irritability means I don't feel safe. It's not, I don't want to listen to you. I want to be an abstinent teenager. There's too many things going on for me to focus on this thing. So that edginess, that lack of sleep or too much sleep, all of those things can point to there's a bigger mental health or holistic health situation happening while we're in the midst of COVID and increased conversations around racial disparities.
Thank you. Tyrone, could you, as a Black male, this is new to us, right? The conversation about mental health, how do we start having those conversations with other Black males and not come across as saying, oh, that is soft, or what are you talking about? How do we have those conversations with other Black males now that we know this is here in our community? Could you just speak to that, and how do we start doing that? How do we sit down with folks and start educating folks about having this conversation with Black males? I think you're muted as well.
Okay, sorry about that. So thank you. Excellent question. As a Black male, let me first start and unpack a little bit of the question in terms of the family structure and our role as parents, as citizens and residents, and for me specifically a Black male. The onset of the coronavirus was one where it left a lot of individuals, a lot of Americans, African Americans in particular, very confused. There were a lot of falsehoods that were initially put out in terms of a specific racial group or ethnicity that was even immune to the COVID. And so where I'm going with this is that in order to have these transparent conversations with our family, as well as with different community members, we have to be cognizant and we have to be honest and seek the truth about the coronavirus itself and how it has impacted our families, how it has impacted our communities. Let me share a short story in terms of just my personal experience as a community manager in my program. When we're faced with youth and teens all day, all night that come to our program with a whole laundry list of different barriers and social issues, a lot of it that has stemmed from the pandemic. We actually have a participant who unfortunately lost her mother during this difficult time because of COVID. Thankfully, we had the resources as a program that were present and were able to help this family, help this young lady out to be able to pick up the pieces. But not everybody has that opportunity. Not everyone has that opportunity even to social distance. A lot of our families, because of the housing crises and just a number of the different barriers that are going on, the social determinants of health alone, a lot of our families are merging together. They're living under one roof. And so when we even talk about social distancing, that's a term often that not everybody is even afforded to at times. And so my biggest takeaway in terms of what I've come to experience, not only my personal life, but just through my professional interactions with our families, our youth, is really being upfront, honest, and taking advantage of opportunities as they come about. As a Black male, believe it or not, at one point I had hair and I had a lot of hair. So even, attending and going to the different barbershops, utilizing those platforms to have these conversations. Not only that, it's one thing to talk about it, but also I would challenge us as parents as well to seek out and find what resources are actually out there. What are some of the resources in which we can refer or at least educate ourselves about in terms of addressing some of the barriers or the challenges in which the COVID has presented in our lives. I think that we are blessed as a city, the city of Indianapolis, to have a ton of resources. I'm proud to be part of this conversation with Dr. Kane and others, which the Marion County Public Health Department is doing an excellent job in their messaging across the city, encouraging individuals to wear the mask, encouraging individuals to practice this social distancing and all of the above. And so for myself, Emil, it's just a matter of really having honest communications and seeking out, doing our due diligence as people, as parents, and our due diligence in learning about the resources and dispelling the mistruths about COVID, because as what's been stated, it is truly affecting our community unlike any other. So that's what I would like to at least share at the moment. I'm proud to share more, but as it was mentioned by Dr. Janetti, I would like to share the platform to the table as well. So,
Dr. Janetti, thank you, Tyrone. Dr. Janetti, you have a final thought before we pass it on to Ms. Boyd?
I just want to make sure that there are some quick things that family members, particularly parents, can do very quickly, and it's taking care of themselves. If you're not in a good shape, there's not much bandwidth for you to help others. So really taking care of themselves, listen to their children, particularly the teenagers, use their imagination. So yes, you can go on staycation, go outside, pack the bag, go outside and come right back inside and still pretend that you're somewhere else. You know, paint pictures and put it on the wall of where you would be going to have that experience, exercise, set a routine. And if you believe in God and have that spirituality, share it out loud so that the students or the children themselves can see where you're getting your source of energy. A lot of times we do it in hidden areas. So it's very, very important that we acknowledge that, and reiterating mind, body, spirit, feeling safe, talking about coping, and where necessary, connecting with as many people as possible. In terms of tracking it, I want to make sure that, supporting what everybody else has said, tracking it really pays due dividends in the end. So pay attention to if the behavior has changed and how often. Are they sleeping less? Are they talking less? Are they doing more of something that's disrupting their current behavior and leading to either minor or major changes in what they normally do? Thanks for the quick opportunity to add a final tip.
Thank you. Thank you.
As Emil, as you stated earlier, we as Black and Brown people have not always dealt with mental health or even thought about it. We just you just have to do what you have to do to make it and survive. But as we are thinking about this, as COVID has came, I want to ask you, Dr. Kane, do you think this has awakened us to thinking about mental health? Because you mentioned a lot of stressors that the parents have. You know, we're worried about paying bills and some of us don't have jobs and homes. So we're worried about those things. Are we now kind of seeing how much mental health plays a role in what we do and then our children as well? You're muted, Dr. Kane. That's okay.
Okay, I'm sorry. We started recognizing even before the COVID-19, when we did our community health needs assessment late 2018, that mental health turned out to be the #1 health issue in the community based on our assessment, focus groups, and everything. And, you know, even though it's on our radar, it was not to the extent that we were shocked and surprised that it was the #1 issue. And, you know, sometimes what happens, we had started doing a lot of education in the churches, but wow, it's just like with this coronavirus, it just ripped open the wound. You know, it glaringly was so obvious related to this. And we've got to educate our families, because they can be insensitive too, you know, when talking with someone who has a mental illness. You know, snap out of it, get a job, quit whining. Or, hey, you need to pray more harder. You know, or why don't you eat more vegetables and you'll be fine. And a lot of times they won't even believe their family member has a mental health illness, or they think it's so simple to treat it. So it's their lack of understanding that can sometimes, with those, and when they make these harsh statements or whatever, our patients of a mental health illness are really more sensitive to this. And so it's amplified. And especially for our youth, it could lead to someone attempting suicide or even being successful at suicide. So we also need to understand how we're talking to people and how that may impact them. But one thing I'm just curious about, we have a lot of cardiologists, okay? We have a lot of family practitioners, but I don't think we have mental health practitioners to the extent who are competent, culturally competent in our communities. So I think this highlights we've got to do more promotion to recruit and get more mental health professionals in our community, because what happens over time, people try to start self-medicating themselves. And this can lead to them getting a substance abuse disorder. And we know that for our Black youth who have mental health symptoms, only 40% make it into treatment, okay? 40%. So that means 60% of them are out there having no care, no treatment, and maybe their symptoms are not recognized. And wow, did you realize that they didn't do well with their homework? It's because of a lack of focus, of concentration. I just can't focus. And I forget stuff a lot. And we're thinking that it's just related to their intellectual ability. It has nothing to do with that. It's related to their symptoms of their mental health, whether it's an anxiety disorder, depression, or bipolar. And the other thing that is a little distressing is for the same exact symptoms in our white patients and our Black patients are more likely to be diagnosed as schizophrenia. Same symptoms in our white patients are more likely to be diagnosed as bipolar. So if the diagnosis may be incorrect, maybe the therapy that's offered to them may not be appropriate. So we have just a lot of work to do on all fronts, but thank God, on one level, we know we have a major problem, and this a lot of times is just a physiological disorder. Physiological. It's a healthy brain. I may be missing this particular neurotransmitter substance that I need to be replenished with medication sometimes. Just like high blood pressure. You take medicine for high blood pressure, nobody even thinks a thing about it. You're diabetic, no one thinks anything about it, that you may need insulin or some other medicines to help you with your diabetes, or you got kidney disease. So we need to be teaching everybody out here, we need a healthy brain and talk about the physiology related to this. Nothing for you to be ashamed about. This is a physiological issue. But we also got to talk to our employers, our schools. Everybody has to have the same understanding of mental health.
Thank you so much, Dr. Kane. That's awesome. I'm Peggy and James Taylor. I have a two-part question for you two. The first part is for you, Peggy, is people think of Warren Township, and I'm guilty of it as well, and we just think of the high school with 3,500 students. But we forget that Warren has pre-K all the way through 8th grade as well, and not just the high school. I can only imagine how elementary school students have been dealing with this, or families. What are you seeing with those elementary school students, and how has COVID, racial tensions, economic downturn, how have all these things affected those students in elementary schools? And what are you seeing with Black and brown students at the younger ages in this last 8 months?
All right. First of all, thank you for letting me be part of the discussion. This has been such a robust conversation, and and so many points. I think when we think of whatever age of student, and you're right, we often think of the high schools and the number of kids that are there, and we don't always think of the younger age of kids, but it's been talked about also, but the stress in any age of child can be impacted. So if our parents are stressed or our teachers aren't whole because they're missing something because of the normal work they do, that this is going to impact any age of a student. I think when we talk about the services, for example, people that are of Black or brown and their access to healthcare. So what are they're seeing potentially their parents or their family members are at higher risk for COVID and up to death. And this is going to impact how they're going to be able to learn in school because the school is kind of a safe place. The place itself can be a safe place for many students. But when all of this is going on within their home environment, while their parents who have lack of resources or their parents who are going to go to work, some of us have benefited of staying home, right? We haven't had to go in to a place to be able to get a paycheck. So it causes a lot of extra stress of being able to have access to the computers, to the technology, the stress that the students then at all ages would feel because they're not kind of part of that group that they're used to being part of. A few things, we haven't touched on a whole lot, but it's kind of that historical trauma and then our current trauma that just adds to what is going on. So these students, regardless of their age, probably watched George Floyd be murdered on TV. That is scary for them. They see that as their brothers, their dads, their uncles, their grandparents. And how are they going to be protected? And we all know that safety has to be with all of us in order to be successful. Trauma, how everyone is affected by that is very significant. And these things have all happened to all students. So it really does impact their ability to learn. They're not at their safe place or their teacher that they can talk to. And so I think that all makes it very difficult for them. And then another thing, whatever system that we're talking about, and Dr. Kane certainly talked a little bit about this, but is the implicit bias that is going on within all of the systems and how that then impacts the access to resources. What is going on within the family? Who's going to have a report called in on them to DCS? And other systems that they work with, whether it's the healthcare system, the school system. So I think all of that those are just really large stressors for students, and they carry a lot of weight on their shoulders to be able to then have a safe place and kind of a clear space to be able to learn.
Wow. Peggy hit on quite a bit there, James. Taken from what she just talked about, so our community has some mistrust, right, with the system and different labels. How do we make sure that this is just not another label or stigma that's put on Black and brown people to say, okay, I come to the resource center, trauma, stress. Now all of a sudden I'm tagged as, my child is looked upon as, how do we make sure, how do we talk to our community about this is not some kind of conspiracy theory, or this is not something that's going to be put on their child to even lessen their chances to be successful in life?
Thank you. And Peggy, she set me up. I mean, so a good setup, so this is about race. Part of it is through these times of social justice and inequities. It's about relationships and it's about resources, the 3 R's as I call them. We're trying to shrink this city and make it smaller. We have a large school district. And when people develop models, they develop models of helping people on a smaller scale. We've developed this model on a large scale. And we're going to work our way down. And as Dr. Janetti says, scale up, from that. So when we talk about systems, and I try to explain this to people all the time, it's social work 101. The kid is in the middle of that system. You take the kid, then you take the systems around the kid, and schools are systems. It's a part of a system. Then you take the system around the school, which is the community. It could be juvenile justice agencies. It could be mental health agencies. When you put all of those systems together and you look at it from an ecological model, if one thing changes in that system, it affects the kids. COVID just dismantled everything. It dismantled every layer of every system that we know of. It's funny, when I got home last night from the resource center at about 9:30, and I was in here at 6:30 trying to get prepared, my granddaughter always meets me at the door, and she always sits beside me. And I was wondering, why are you sitting beside me so much? Pawpaw is tired. I'm ready to go to bed. I gotta have dinner. But she sets her alarm clock, and she just started doing this at 8:30, and I hear that alarm go off, and I know she's running somewhere in the house towards me to give me a hug. It's that social isolation that we're talking about. And at first I was like this, I'm like, oh my God, please stop hugging me. Then after a while I figured it out. I'm like, she needs to talk. And yesterday I jumped on the phone and she said, Pawpaw, why do you jump on the phone when I'm trying to talk to you? I'm like, wow. So this is not this, and she's here today. So what I did this morning, this place looks like them. We are 75% Black and brown kids. So when you walk in here, we are a diverse system. We have Black art, we have Hispanic art, we have cultural art on the wall. As a matter of fact, when I walked her down to one of the pictures, I said, what do you see in that picture? And the picture says 1,000 things. And she said, we are not slaves. We must work hard in life. So we're surrounding our kids with people that look like them. We're making them feel good about themselves. And as Dr. Hansen said yesterday, man, this feels like home. This is not a school. This is like home. And once again, let me go back to relationships and resources. I had a Hispanic family with 6 kids who got put out of her home the other day, okay? And my navigator called every shelter looking to get her in. They were hanging up on her through our coordinated entry system. They were hanging up on her because somebody at the front desk receives thousands of calls a day, and they were tired of saying, we're booked, we don't have any space. But once again, it's about relationships. So I called right over to Wheeler Mission, spoke to the person in charge, and he said, you got to call somebody in charge, James. And I'm like, I know. So we got her in. So this resource center is 7 years in the making of relationships with everybody that you see here, okay? And I go all the way back to when I worked for Dr. Kane at the Marion County Health Department, the Action Center 30 years ago. It's about relationships. I put Eskenazi in, our community was already here. This is how we build or rebuild our community. And I'm gonna give credit to my superintendent. He had the vision through our strategic plan to say, we're not gonna talk about it, we're gonna be about it. Here's the money, I'm gonna reallocate some money, and this is what we're gonna do, because we know that in January, families are going to be evicted. We know it's not a matter of how, it's when they're gonna be evicted, and we wanted to set ourselves up to be in a position to help our families. So no, this is not a charade. This is for real, and this is real life. And if school systems can do one thing and reallocate some dollars to social issues, we put a lot of money in curriculum, we do a lot of things. Our superintendent, we're trying to get it right. I took a walk around our community the last week, knocked on doors. You know, I went to one of our communities, Washington Point, and it was a sad sight to see. We have to get out into the community, see what's going on, and build our social justice and equity plans based on what's currently happening within the communities that we serve. So we can no longer look at what's happening globally. We have to look inward and fix what's right in front of us. And sometimes when we talk about equities and social justice, people see those things on TV. No, this is right here in your backyard.
Wow.
So what are we going to do and how are we going to do it? In the Resource Center, we call it MCRC. This is our way of giving back to the community and the parents.
Wow. Thank you so much, Peggy and James. Powerful stuff. I'll see you.
Wow. As a parent, I'm just excited to find out more. We're kind of talking about the Resource Center, but we haven't really got the details of the Resource Center. So Dr. Henson, do you mind kind of explaining what the Resource Center is, who can access it, how they can access it, what you guys will do there? Because when you say it sounds like home, that makes me feel good as a parent to know there's a place my child can go that they feel comfortable.
How much time do I have?
As much as you need to explain it thoroughly. We're okay.
You've heard a lot of why we're doing it. And I hope some of you are able to come by today. And if you're not able to come by today, please stop by as soon as you can. As everyone has mentioned, there's a lot of barriers in place of why our kids aren't successful or our families struggle. In the Resource Center, we've always been responsive to those challenges in our community. But I love the quote, it's easier to build a strong student or a strong kid than it is to fix a broken man. And we want to build, the other quote I love is it takes a village, right? And when we look at what's best for kids, it's surrounding that kid with adults that can support that student. And really the vision around the Resource Center is empowering our parents and families so they feel confident and skilled and have the tools to support their kids, to fill their kids with life. So a couple ways we can access it. James and his team, that our navigator and coordinator and all the folks that he has there supporting it, will have two accesses. One is from the school system, and I look at the Resource Center as a bridge. My comment to James about it feeling like home, our schools are very structured and rigid. And as much as we welcome our families, they're not always welcoming to our families. And that's not that we don't want them there, but sometimes they don't give off that vibe. The Resource Center will be welcoming to our families because when they walk in, they'll see themselves in the Resource Center. We have student artwork there. We have local artwork there. We're going to have other community events there that our community will see themselves as part of that. So it's a bridge. It's also a hub. Life is hard. Navigating all the systems that exist is hard for anyone, especially when you have all these other social injustices and health crises and food deserts and all these other things that exist, not just in Warren Township, but across our communities. I see the Resource Center as being a hub. It's a one-stop shop. So when families come to us and we have that empathetic spirit and ear and listening to all the needs that they might have to get back on track or to get ahead, we'll be able to help and support them in one location. It won't be a matter of call this person or go meet with this person. We can centralize and organize those supports there. We'll have a referral process through our schools. A lot of times our teachers and our counselors and our principals firsthand see, hey, this student hasn't showed up for 5 days. Attendance is a leading indicator of there might be some struggles going on. And right now we are struggling. Attendance is a huge issue for us. And all the things that have been talked about with, social distress and depression, that concerns us greatly. Because if they're not showing up, there's a reason for that. And unfortunately, it's probably not a good reason. They're either not sleeping or they're sleeping too much or just they're hopeless and they're not engaged. So the Resource Center will also be open Monday, Wednesday, Friday from 8 to 4. Tuesdays and Thursdays will be 8 to 8 because we know those office hours don't always work for all of our families. We're also going to be rotating some weekend hours in there. And we have hotlines set up. We have a phone number hotline as well as an email hotline. So at any point, if our families are in need of support or resources, they can reach out to us through that as well. I know Mr. Taylor will probably add a couple things to that, but I tried to get it in there as fast as I could.
You said it well. I want to share the space with other people.
Yeah.
Well, thank you so much. And so each of the panelists, you guys are involved in the Resource Center in some capacity. Is that correct? So I want to go through each and ask each of you kind of give me briefly, if you can briefly, kind of what your capacity is so that those who are watching can kind of see a familiar face or know a familiar name and feel more comfortable in knowing, okay, if I have this issue, I know that this issue will be addressed or could be addressed. So I'm just going to go through the way I see the panelists on my screen, and you probably see it differently. And some people keep moving around. So I'm going to start with you, Dr. Genety. Can you kind of tell us what you do at the Resource Center?
It's odd that you start with me, but I'll gladly pick it up and go from there, simply because I'm an outside architect in some of the process, working with Dr. Hansen, working with Director Taylor, looking at some of the research data that we can gather, in addition to just setting up the model itself. And I just shared with the panelists that this model of resource center is very different than you have seen across the entire US or across the world. And that's largely because it focuses on the student. It holds on to them. Other models say, oh, you know, we can't offer this. Go to this shelter, go to this place, go to that place, find your own transportation, find the phone number on your own, go to them on your own. This one holds on to the student and it holds on to the family and say, we still want you to be here. So ensuring that we keep those sort of practices at the forefront of what we do speaks to the innovation of Warren and to its leadership and to why this will be a success. So parents and anybody stopping by or calling into the center will know that this is not your old time version of doing support or care or offering resources. And that's where I fit in.
Thank you so much. Ms. Center, can you tell us what you will be doing? Well, what your involvement is with the Resource Center?
Yes, thank you very much. Our agency will be providing an emotional social skills support and development program called REACH. And it's an academic and employment readiness program that will follow a student from 8th grade and freshman year all the way through graduation. And we will be helping parents and youth to have that sense of security around attendance, academics, making sure they have all of those skills and supports around 3 primary areas. Will, which is the persistence and motivation to stay engaged in their class work and to identify what they need to in order to succeed. It's also around emotional regulation. What are the things they're going to need in order to deal with and cope with all of the issues that might be surrounding them or their home environment or the community environment, so it doesn't disrupt their academic learning. And then we're going to help prepare them for the next phase of classroom, whether that's matriculating to the next grade or successfully graduating from school. So our REACH program is going to be there to support parents and youth. It's going to be available to parents as well as youth, because we want to get them ready for success in school and success after school. Get them in touch with those high wage opportunities that's going to come to them. Not everybody wants to go to college or needs college, but they need to be prepared for the 21st century employment. So our program is going to be there to support all the other community providers as well in whatever needs they have, and also those mental health issues, because we can be there for parents as well as the youth, not directly on site for those services, but we can be a referral for those families when they have those needs.
Thank you so much. I'm going to go to you now, Mr. Humphrey. You're next.
Sure, thank you. So our role is one that I find to be very significant. Indie Heartbeat initially was developed through a collaboration with the Marion County Public Health Department and Eskenazi Health in terms of addressing and working with youth experiencing some behavioral challenges that require some sort of intervention in their life. Our commitment with this project and this overall model is to continue that work, to work specifically with youth and families to address some of the cognitive and behavioral concerns that could at times perpetuate criminal or volatile behaviors. Our role also is to address and work with families side by side as they come to experience some of the social determinants that which a number of our families are experiencing, but yet to be there as an advocate and an ally to see them through, tapping into resources in which maybe a family may not be able to access, or even with the ability to navigate through our healthcare systems. I mean, it's very challenging for the outsiders, let alone those that work within the corporation. So our role, again, is really to support, as Mr. Taylor spoke on earlier, the social ecological model in its efforts, really being a part of this community, being a servant to this community. And at the end of the day, our goal is to reduce the risk factors that, again, perpetuate some sort of behavior. But our goal essentially is to definitely increase the protective factors to keep these youth and these families in a more secure and safe and thriving environment where they have an opportunity. And that's what Indy Harvey Eskenazi Health is looking to do.
Thank you. Thank you so much. Ms. Flynn, can you tell us your involvement or your organization's involvement?
Yeah, so community partners with the schools, and we have therapists on site in the schools. And historically, until the opening of this resource center, it's kind of been to connect with families with resources. It's been the relationships that each individual therapist had. So I have a history working with the homeless youth population. So a lot of it would be filtered through me to, I've made those phone calls, Mr. Taylor, to Wheeler as well. I got my girls over there. But to be able to now plug all of us into this resource center and kind of partner with the school in that is a really exciting thing for community to know that now those relationships are interweaved and we can support the students better together than kind of trying to figure out who knows who and what's going on where, but to do it all as a group, I think is really exciting for all of our therapists.
Thank you. And Mr. Taylor, you're the director, correct? And so what does that mean?
I'm the person that plays the flute to bring all of these people together. It is, like I said, it's a kaleidoscope of love and relationships. And I couldn't have done it without establishing relationships with all of these people. And if you know me, before I leave the table, I'm always going to ask for something. Okay? I'm asked for something. So, and when I ask, sometimes I just throw stuff up in the air and see if it sticks. And it's been sticking. So with that being said, really we've vetted these people for 7 years, and it's about playing fair on the playground. It's about having the conversations in the community, and all of these different agencies were working in isolation, and everybody was working on the same thing, but nobody was really executing and getting to where they needed to get to because they didn't have an in the school. And schools sometimes can be difficult partners because we protect our data, we protect our kids, we kind of protect what we do because we don't want to be damaged by people on the outside because our jobs are hard. So our superintendent opened up the doors and said, look, we can't do this by ourselves, we need help. We looked at other models and he asked my opinion and I said, no, I got a model for you. We're creating it as we speak. We talked about innovation and I said, well, why are we looking at other evidence-based practices? We got Dr. Janetti and other researchers, let's create our own. So he's trusting me in that process because a lot of people knocked on our doors and said, hey, why don't you come over here and do this with us? And I said, no. And he said, okay, James, I'm waiting on you. And I'm like, hey, it's coming. So Peggy Serby has been great. The first relationship that we started was with DCS. DCS is not the enemy. People see DCS as the enemy, especially in the Black community. It's like, oh, here comes DCS, hide everything, So we're debunking that stereotype and that myth. DCS is our friend. And when I say that in public, people are like, what are you talking about? I'm like, they got all the resources in the world. You need to be friends with people that got resources. So Peggy has been awesome. I'm on the regional 10 council. She's opened up her doors, her wallet to me. So it's been an awesome experience. I can call Peggy, I can call anybody on this panel and say, hey, look, I'm having this dream. Can you help me get to this point? And they'll help put the pieces together for me. I'm a visionary, but I surround myself with people that can do some things that I can't do. And I realized that, and I told my superintendent, he actually told me to slow down. He said, James, I'm not following you. James, sometimes you're out there, I got to pull you back in. But once I pull you in and you try to explain it to me, he has to process it for a while. If he'll allow me to keep building that pyramid, he won't stop me. He'll say, build it slow, James, until I catch on, because he has faith in me. So we've assembled all of this, and we're still assembling it, but it's here now, and we're going to make everything work. And we're asking that all of the agencies play fair on the playground. You know, who said that Eskenazi can't work with community and community can't work with Reach for Youth? I've broken it down. And Dr. Kane, you'll like this. My experience with the Marion County Health Department with the Action Center explained to me what a community agency does. That's what a community agency does. I've broken it down into 3 categories. You have the grassroots agencies, that's through Peggy, Serby, and DCS. Providers you've never heard before that are putting in the work. You have community agencies such as Reach for Youth, the Action Center, Marion County Health Department, and other agencies. Then you have corporate organizations such as Gallagher, Cummings. If you put all of them together and get them to play well on the playground, my, how many people can we serve? And we've been able to do that. So I'm just the Pied Piper. That's it.
Well, thank you. Dr. Hanson, you got the right man for the job, because we can all feel his excitement and passion.
He is our disruptor. There's a lot of things that we need to disrupt in a good way, and our connector. He is a magician at doing both of those.
Yeah,
Good trouble.
Good trouble.
Good trouble.
You can say slow down, because man, Mr. Taylor is about his business.
I just want to go with them. Just slow down so I can go with you.
It takes a minute for everybody to understand, you know, schools are kind of, I used to say to Dr. Hanson, unilateral in their approach, but Dr. Hanson believes in coherence and having a few projects to make those projects work. And he's reeled me in to help me to understand that, but he's allowed me input, you know, so that I can help explain what's going on with the juvenile justice agencies. I can explain what's going on with DCS. I can explain what's going on with some of these other agencies to bring all of those into the system of the school. And we've trained our providers to understand PBIS, to understand second steps, to understand all of the programs that we have, so that we're not operating on a different DOS system. Everybody has to be on the same page.
Wow. I don't know what PBIS is. But it sounds like you know what you're talking about.
Amani would.
I'll try.
Yes, I believe she would. Thank you so much. Now, Dr. Kane, what is your involvement?
Sorry, had to unmute myself. So, you know, one of the things that during this pandemic, we got into different businesses that we had never gotten into before. So we actually got in the homeless business.
Mm-hmm.
So we had contracts of like 7 or 8 motels, and then we had a huge hotel to take the people like out of Wheeler's Mission and put them in hotel rooms where they had beds and they had their own bath and showers and whatever, in terms of trying to make sure they were safe for coronavirus. But a lot of people are not aware of this. We have a significant social service department with about maybe 16 employees. So when you're kicked out of your house or apartment, we can help provide services there. Your electricity bill's going to cut off, we can provide services there. So we love to have partnerships like with James in terms of being a great resource for individuals. And sometimes we have the connections too with other agencies that you can just pick up a phone and it makes a difference. So he is really emphasized when I talk about partnerships, it's been really critical. And I have to publicly thank Dr. Hanson, because to keep these kids in school It's significant. And I've learned so much from our superintendents, from all of our public schools and other schools. And Dr. Hanson has just been phenomenal and given me a lot of technical background related to this. But I will say, my mother was a school teacher, my father was a teacher, my brother's a teacher, and my sister's a teacher. And so I've been already inoculated, as they say. So anything we can do, any services we can provide, we have resources, and please, everyone, continue to call on us. And we have a adolescent up to babies community health centers. So, you know, we got community hospital, we have Ashkenazi, but I got a whole community health center, health educators, social workers, you know, call on us, and we're happy to provide healthcare services, and folks never have to worry about whether they have any money or not, or whether they have any insurance or not. Come and see us. And for even our Latino population, we never carry at all, whether you're undocumented or not. We are a safe haven. Come and let us provide resources. But you've got some wonderful hospital systems here. Ashkenazi community, we got some of the finest hospitals in the country, not just the state of Indiana. And I'm just so impressed with all of our mental healthcare professionals here. They're just doing a tremendous job. I think this can be a national model now. So, OC, you better get it together. This is a national model.
We're
Help
working
with
on it.
that promotion for us.
Thank you so much, Dr. Kane. And thank you for letting our Latino community know that it doesn't matter their document status. I think that's
exactly right.
Very important for those who need assistance to know that this is a safe place for them. And last but not least, Ms. Serby.
Thank you. Thank you, James, for those very kind words. I think coming together with James about 7, 8 years ago, I'm not sure, it was actually like a reconnection. And as I shared with James, the prevention programs that we work through. So we, each year have about 40 to 45 prevention providers. Many are grassroots providers who work within the communities that our students, our families trust. So breaking down those silos, it was said earlier that, Marion County is so rich in resources, but it's maneuvering through and how to connect families to those services. And as James talked about, is like really getting a hold of the right person. So in doing that and sharing those resources with James, we were able to really create a meaningful collaboration. He was able to tell me what they need in order to make this successful, so we could go back and say, okay, if we're going to release an RFP, then what services do you need to make this happen? And so through this time, we've developed this amazing collaboration, breaking down the barriers, because we can all agree children need a loving, caring adult, and they need their basic needs being met. And that is not abuse or neglect. And we would rather the prevention side of this work effectively and not come to a place where the stress is so high or a child is injured. And through this resource center, families can access this multitude of services. And so we will continue to partner, help James provide. He was put on our regional service council so that education system has a voice so he can tell us what is needed. We have an East Side office. There's a great collaboration between that office and Warren Central. They do some amazing work together of just trying to get the services needed for students. And if a child is in the system, that it's a better outcome, a better process. And so I just think, what are we going to continue to do from DCS? We're going to listen to James. We're going to continue to promote those relationships and have a meaningful collaboration so we can see improved outcomes for children and families.
Thank you. Thank you so much. I just want to kind of follow up now that everyone's told us their roles in what they do at the Resource Center. Maybe Mr. Taylor and Dr. Hanson, you might want to both chime in on this. As a parent, many times we know we need help, and schools are definitely the community. We know that schools, that the community, it's kind of the heartbeat, the hub of the community, if you will. So, but many times as parents or as caregivers, we're too proud to ask for help, or we don't want to be labeled. Like you mentioned, DCS is your friend. We don't want DCS involved because we're afraid that our child could be taken away, or that we're looked at, because we need help, we're looked at as if we're not a good parent. We're not doing what we're supposed to do. How would you help the families in your district get over that pride and reach out and understand that what happens here is not about judgment, it's about help? I mean, I think that's a huge hurdle for our community. So I don't know, Mr. Taylor, if you want to go first, or.
Yeah, I'll go. Well, we've had several food distributions throughout the summer. We reach out to our families. We collaborate with Eskenazi, MLT, and other agencies. Once people know, John Maxwell, I think, said it best. People want to know 3 or 4 things. They want to know, do you respect them? They want to know, do you like them? They want to know, how can you help them? And do you value them? It's all about value. Once they realize that they're valued, they'll keep coming back to you. It's as simple as that. I'm not going to go, and make up some other stuff. Do you like me? Do you respect me? How can you help me? Do you value me? And the people that we have working, they make everybody feel good. Our motto is 7 steps, and I'm going to get the steps mixed up. If we go back to the old 60s, 70s, sometimes 80s gas stations, where you didn't have to get out your car and you pull up and you'd say, the guy will come out and say, how can I help you? And you'd say, I like $10 unleaded, please. All right. And then while you're waiting, they'll say, can I check your oil? Oh, yeah. Can I wash your windows? Most definitely. Can I check your tires? Yes. With our families, for whatever reason they're sent here, we're going to ask those other questions, because there are always problems underneath problems. And as Dr. Janetti said, we're the only agency that tracks kids from K to 12. So the data that we get on our kids, and we've never kept the data that we're going to get now, the data on when you help a family, and this is where Dr. Hanson is right on the money. We want to track the data, but when we help a family, does it impact the kid? That's what we want to see. So we'll be able to go back and see when we gave you food, when we helped you to get a job, we're going to look back and see if their kids' grades went up or down, and how long did they stay getting assistance. We want to track that data. We track everything else, but the most important things that we should track, we haven't. Now we're in a position to do so.
Thank you. Yep. Dr. Hanson, do you want to add anything?
The only thing that I would add is just that I want our families, I want our community to know that we do care. And the Moorhead Community Resource Center is, yes, it's a building, it's a physical location. People will be able to see it. It's on a bus line. We tried to make it as convenient as we could it's centralized in our community. So when you ask, how can we help our families, we got to build that trust. We got to build that space and that place that they feel safe. We got to make sure that it comes from a non-judgmental approach. We're doing this for them, not for us. And, it's going to take time. We're in tense times, right? There's a lot of energy out there. There's a lot of emotion out there. And we have relationships with some of our families. And we hope that word of mouth and, once they hear it, see it, and feel it, that they'll believe it. And it's going to take some time, but I know we have the right people. I appreciate everybody on this screen who's supporting us with this work. As somebody said before, no one else is doing this. And I'm excited to be the pioneer to get out in front of it, because our kids are going to benefit from it.
Thank you so much. As we wind down, we have about 10 minutes left. Warren Township has a great tradition of championships, right? And it goes back decades. With this project, how do we define wins? a year from now, 5 years from now, how would you share with the community as far as we are actually, this is working, we're winning doing this? If you can, Dr. Hanson and James, if you guys could just talk to us about what should we expect to see, or how do you define those wins as we go along? And then 5 years from now, what should we see ideally from this facility?
Yeah, I'm gonna do real quick. I'm gonna defer to my partner because I asked Dr. Janetti that question when it was asked to me, because she's the researcher, and I said, how do we evaluate our success? So can you answer that for us, Dr. Janetti? Then we'll elaborate.
I actually didn't prepare for that one, but sure, I'm going to jump right in. When it comes to wins, we did not just want to track visits, but we wanted to track the opportunity that came out of those visits. So yes, it's visits, yes, it's relationships, yes, it's employment, yes, it's jobs, but the overall structure was, are we keeping students engaged in school? Are they still graduating? Are they still with us? Are they still earning credit? The second was based on the number of people coming to the center. So if we look at 50 families being referred to the center, how many resources did we provide? How many community partners did they connect to? How many partnerships that we, hopefully Peggy, it's on the positive side, students that we did not send through DCS because they were a beneficiary of the services. So it's on both ends of the process that we're tracking.
You see, I let her answer that because I couldn't answer it as well. So yeah. Follow that, Dr. Hanson.
It's about outcomes, right? We want our families. I hope in 5 years there are some families that we don't see, or they're coming back to help other families be successful. We want to empower our families. We want to. The main foundation of this was to empower our families so they could lead themselves. They can support their students to be successful. And I can't wait for the wins when we hear the success stories from our students and our families. And it's not about thank yous. It's about them feeling good about what they're doing and confident and being able to navigate life.
If I could just jump in and say,
yes,
I think that what's being designed and what has been designed is already winning, because the fact that all of these entities could come together as they have, the fact that you have this resource center that we're going to celebrate today, the one thing that everyone feels when they go in there is this great sense of hospitality. What coronavirus has done is just discombobulated the sense of routine and what's familiar and the things that people could count on. But now this resource center is a place that people can rely on. They can feel that they can trust the relationships that's there. They get a sense of people who they can rely on, and they get this great sense of hospitality, which is one thing that will help people ask the question of not, do I have a problem, but how can I help you? What can I do for you? And I think that's what parents are looking for. When parents get that question, what can I do for you? They can tell them without a sense of shame. They can say it with pride, because our families are resilient, our communities are resilient, and they are going to celebrate this experience. So I think it's already winning. And I just want to congratulate Dr. Hanson and James Taylor and everyone who's here, because this is a tremendous opportunity and it's very exciting.
Thank you so much, Denise. Peggy, as a partner coming on board with this, what is your expectation of a win? Looking into it as you come on board as a partner to support this?
I think that there are several. One is that ongoing collaboration, so that if we do have families in the system, that we are creating a better working relationship that makes it more seamless for the families. There's a kind of a saying that goes along when we talk about trauma. Instead of looking at a family and saying what's wrong with you, you look at the family and you say what's happened to you. And that goes along with how we can help. Of course, if we can see less reports, I think that's a huge win coming in, because we know the families being cared for by this system, a big system that's been put together through this resource center. So the ongoing collaboration, seeing healthier families, families that are more supported, I think is a great win. And we've been working together for quite a while. We've seen some of these wins already through the Alternatives to Expulsion program, and how we did not see recidivism coming back in. And that's a huge win. And so healthy families. So thank you for both you, Mr. Taylor and Mr. Hanson, because this is just an amazing opportunity, and I'm very thankful to be part of it.
Thank you, Peggy.
Awesome. Megan, for community, what's your expectation of a win? And what do you see, or how would you support this program going forward as far as wins are concerned?
Yeah, I think Peggy had some great points of less reports, and then also healthy families. And what that looks like for us is, our clients may be graduating from services because they're no longer needed. They've learned the skills, they've gotten the support, they know where to go within their community. And so as a therapist, like working ourselves out of a job because these clients have learned the things that they need to be successful. Yeah, and then also us being able to, as therapists in the schools, being able to rely on this community center and that to not even be a hesitation of where we can go. We're excited about that too.
Thank you so much. Tyrone, for you as well, like what's a win in this? You had some really, really powerful statements early on. Coming into this, what are your expectations for wins?
Right off the bat, our expectation is just to really maximize this collective impact approach of bringing these different partners, grassroots organizations, and wonderful people to the table. So for us, there's already that we feel as if we've won just to be part of this wonderful opportunity. In terms of our clientele, our patients and family and community, we look, what we're looking for in terms of a win are the behavioral changes, the knowledge change, being able to share, provide, and connect individuals to different opportunities and resources throughout the community. And as I mentioned earlier in our conversation, and ultimately it's increasing the protective factors. We want to see our youth thrive. We want to see them safe. We want to see them graduate. And we definitely, as Peggy mentioned, we want to see a reduction in a recidivism rate as well. And so, we're not about checking a box. I think often that's too easy. And that's not our goal. That's not our program. We are truly a program that looks to, again, increase the protective factors, but to also grow our program based on the responses of the community. So whereas now we're in collaboration and we're talking with James Taylor and others about growing mentoring opportunities, building and mending these gaps and perspectives in terms of the poor perception about law enforcement and bringing them on board, having them part of the conversation, so we could be an entire community that's all practicing one thing at one time. So that's what we're about. And again, we're just happy to be a part of this opportunity.
Thank you so much. I will say this before I pass on. First of all, an amazing panel, amazing work of Warren, unbelievable work at this time and much needed innovation. Brother Tyrone, we need to get you out of Warren and to speak more, right? We need more brothers out talking to our community about mental health and educating people. So thank you so much and for being on this panel. Again, powerful panel. I've learned so much. This is unbelievable. I can't wait to get over to Warren and come see the facility itself. But thank you so much. This is so needed in our community today, and appreciate Dr. Hanson, your foresight of allowing people to come together and make this happen. James, as usual, always fighting and driving in the community, so thank you. Osea?
Yes, thank you, Emil. Thank you for being a co-moderator with me. You've done a great job. I'm a journalist, so I try not to hog up all the questions. So I'm a journalist by nature, so I love to ask questions. Before we go, Mr. Taylor, can you quickly give us the dates and times that Moorhead is open?
I don't have that in front of me. Dr. Hanson, can you do that for me?
I do. So Monday, Wednesdays, and Fridays are 8 to 4, 8 o'clock a.m. to 4 p.m. And Tuesdays and Thursdays, it's 8 a.m. to 8 p.m. We have not worked on our Saturday schedule, but it is our intention to have some Saturday hours as well, to be responsive to all of our families' needs.
Thank you so much. And thank you all for tuning in. I've learned so much, like Emil said. I'm going back through as a parent thinking, where can I improve? I don't like to tell people where my daughter goes to school because I don't want anyone to think I'm biased as a journalist, but I am a proud Warren parent, and so this just makes me really excited. And I definitely will come by and check out the new facility and kind of see what we can do as a family to make sure that she has the support she needs, because I know I definitely can't do it all. It takes a village. It certainly takes a village, and you guys have helped me realize that so much more today. So thank you. Thank you so much for taking the time this morning to share the awesome things you're doing, and everyone have an awesome day and an awesome weekend.
Email, Ms. Boyd, thank you all so much for putting this together. We appreciate you all, and make sure you stop by. We have a trunk or treat tonight for the kids between 3 o'clock to 5:30. So we're also giving out food boxes from McFarland. So you're more than welcome to come on through.
Thank you. Thank you for the information.
Thank you.
Thank you, everyone. Have a great Friday.
Thank you. Bye-bye.
Bye-bye.